Hi guys, welcome to my YouTube channel Unique Bio Classes based on NCERT syllabus for PUC first and second year. If you like my channel, please subscribe, like and share and hit the bell icon so that you can get notifications as soon as videos are getting uploaded. Okay guys, we shall start today's video. In today's video, we are going to discuss about sexually transmitted diseases or sexually transmitted infections. Okay, in newly updated books it has been mentioned as sexually transmitted infections. In older textbooks it is sexually transmitted diseases. Both are one and the same. It is diseases or infections. Okay, STDs or STIs. This is in your textbook on page number 63. Okay, so I have prepared a note of it. First I shall discuss about that one. It's a very small topic, very important, okay, and easy to understand. As here I have given sexually transmitted diseases, which is called as STD. In short, it has been mentioned as STDs, or it is also called as sexually transmitted infections as STIs or venereal diseases. Okay, or even it is called as reproductive tract infections. These are the different names for STDs. Okay, so with this we shall start. What are these STDs or STIs? Diseases or infections which are transmitted through sexual intercourse. Okay, diseases which are transmitted through sexual contact, diseases which are transmitted through intercourse. For those we call it as sexually transmitted diseases or sexually transmitted infections, or when any one of this. Okay, example, which are those diseases? Gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, AIDS. Okay, these many number of examples I am giving. It is there in your textbook too. But here, every example is very important in terms of a NEET exam, and even with that, it has been asked in 1 or 2 year question paper. What are STDs? Give 4 examples for 2 marks. Okay, give 3 examples. This kind of questions we have got. So for that reason, you must remember all the examples, right? Easiest way is the diseases which are transmitted through sexual contact. We call it as STDs. With this, you have here, next I have given some note of it, hepatitis B and HIV, the diseases which here it has been mentioned as hepatitis B. Okay, hepatitis B and HIV. HIV is nothing but it's a name of a virus which causes AIDS, right? So hepatitis B and HIV can also be transmitted by sharing of injection needles, right? And that is infected person's needles. If needles which have been used for injection that of infected person, then it can be transmitted. As you know, nowadays in needles which are used in injections, those are not used one. Okay, unused syringes have been used, unused needles have been used, so that helps us to stay away from the diseases. If in sometimes, if in this case occurs, if that used needle, if it has been transferred of an infected person, then definitely these diseases can be transmitted, hepatitis B and HIV. Through surgical instruments. Through the surgical instruments, it is used in surgery like scissors, okay, scalps, whatever it has been used in the surgical instruments. If it has been used on one patient, and same surgical instruments without sterilizing it, if it has been used on another patient, then that also can be help to transfer the disease or infect that person. Transfusion of blood. Transfusion of blood, you might have heard about the blood donating and all. So if a person, if he is in need of a blood, if that blood is not pasteurized, or if it has not been tested, that blood is having infection already. So that blood, when it enters into a normal person, then definitely that patient who was normal, now he will get a hepatitis B or HIV. So infected mother to fetus, that is a pregnant mother. If a mother is pregnant and if she is infected, then that disease can be transmitted even to the fetus. Which are those? Hepatitis B and HIV. Why we are mentioning only these two? Okay, these two diseases can be transmitted through sexual contact and through other modes also. Mode of transmission, other modes are also there. But other diseases which we have given here, those are only transmitted through sexual contact. Okay, hope you got. Except hepatitis B, genital herpes and HIV, other diseases are completely curable. Except these 3 diseases, helpful in your entrance exam. Okay, so they can ask except which one of that would not be treated, or which one of that which can be treated, something this kind of questions. So every point is important. Understand the each and every bit. then it will be easy for you to answer the questions. Except hepatitis B, genital herpes and HIV, other diseases are completely curable if detected early. Okay, if these diseases are detected early, then they can be treated. Which diseases except this? Like here we have given hepatitis B, you can find genital herpes, and one more is HIV. Leaving this, rest all gonorrhea, syphilis, genital warts, trichomoniasis, chlamydiasis, these can be treated if it has been early identified, early diagnosed, early detected. It can be treated, it can be cured, but not these three. Okay. Next, what are the symptoms of this? For symptoms of this, you will find that, as it has been mentioned here, first one, itching, fluid discharge, slight pain, swellings. Itching, as you know, itching takes place especially in the reproductive organs. Fluid discharge from the reproductive organs, slight pain, and swellings in the reproductive organs. If it is there, then there are chances of sexually transmitted diseases to that person. Infected females may be asymptomatic. Okay, if a female is infected, she might not show symptoms. Asymptomatic means not showing the symptoms and remain undetected for long. Okay, which means females are asymptomatic for a long time, so that if a female has got a 1 or 2 years back STD, then also she is not diagnosed. Why? Because she is not getting any kind of symptom of it and she is unaware of it. So for that reason, it will be undetected for long. For this is the reason that many of the females, after getting the disease after 2 to 3 years, maybe 7 years, maybe 10 years, after a long time, then they are getting some symptoms when that is infection has become very serious and it has been transmitted all over the body. Then she is approaching a doctor. At that time, no one can stop it. Okay, so if it has been detected at an early stage, it can be cured. If it is not, then it could not be. So, but in females, it is asymptomatic. Why? The question is, why that females are asymptomatic? Because the common minor symptoms which has been mentioned here, those minor symptoms will be found in the female normally, which she might take it as normal. Okay, because of menstrual cycle and all, she might take it as normal. If these kind of symptoms might be, if they are appearing, at that case she might think that is a normal case. Sometimes it is not at all visible, so in that case she will be undetected for a long and it is asymptomatic. Okay, next, absence or less significant symptoms in early stages may lead to complications, right? If there is an absence of symptoms or there are less symptoms in early stages, it will lead to complications. Okay, it will lead to complications when later stages, right? If early only, if it has been detected, easily it can be diagnosed. If it has been not been detected, in that case, it can lead to complications in a later stage. Later stage are what? Pelvic inflammatory diseases. Okay, in the pelvic region. Pelvic region is what? That is between the two thigh regions. What reproductive organs is present? For that we call it as pelvic region. So pelvic inflammatory diseases, the diseases which are found in that region, for those we call it as pelvic inflammatory diseases. There will be abortions, the chances of abortions, and stillbirths, which means the newborn has the fetus has not fully developed. Ectopic pregnancy, which means continuously there will be every time there will be an abortions. Infertility. Okay, infertility, which means in the next topic we are having that infertility, where an individual is unable to reproduce. Infertility and even cancer of reproductive tract, there might be a cancer in that patient also. Okay, so these are the some of the complications if that disease is not diagnosed or it is not being seen in an early stage, or because of absence or less significant symptoms in an less significant symptoms in a patient. Okay, so these are some symptoms and some note of it. Right, now this is given in your textbook here. As you find, as I said, on page number 63, you have that information here. Okay, now this is commonly found in the age group of 15 to 24 years. Okay, among the persons who are among 15 to 24 years of age, in that it is very common. So now 15 to 24 years of age means you also come under that. So there will be you might be thinking about that, how is it possible? 15 to 24 years of age, because in this age there is a teenage, and there is a lot of changes in the body. So people might go enter into wrong things which they might not knowing about it. So this is the age where it can chances of these STDs are more. So the individual must be very careful of it. So because of this reason, this age is very particular. So that's why this age people should know what are STDs and how it is transmitted, and how it can be prevented. So for that reason, the prevention is better than the cure. Hope you know this. For the prevention, here they have given some preventive measures. Okay, some preventive measures are there. First I shall adjust the camera so that you can find those preventive measures. Okay, so preventive measures are there. Those preventive measures you can find. First one, these preventive measures are very important. Okay, because they have asked write the preventive measures or principles to avoid STDs. Okay, so first one is avoid sex with unknown partners or multiple partners. Right, the sexual contact with unknown partners, with multiple partners or many partners should be avoided. Always use condom during coitus, is it? During intercourse or during sexual contact, condom should be used so that it will prevent fluid exchange between the two individuals. So chances of STDs will get reduced. In case of a doubt, if anyone is having a doubt, one should go to a qualified doctor for early detection and it get complete treatment if diagnosed with disease. Okay, they should get a complete treatment if they are diagnosed by the disease at an early stage. So these are the three. I have added one more. It might not be visible for you. I will just read out. Hope you can copy that one. Avoid blood transfusions from drug abused or infected persons. Okay, so avoid blood transfusion from drug abuse or infected person. Drug abuse is what? And many of the people are abusing the drugs. Okay, many of that cocaine, heroin, these kind of drugs have been taken by many of the individuals. So that is called as drug abusers. That drug abusers, they are using syringes to have that drugs. They are using many of the techniques, and that same syringe will be used by the other friends also. So the transmission of diseases is very fast in those kind of individuals. So avoid blood transfusion from drug abusers or infected persons. So it is very easy to understand because this is the mode of transmission. If that is avoided, then it's very good. So what we have given in mode of transmission, that it is getting transmitted from infected persons through blood transfusion, and second one is sharing of injection needles and surgical instruments to be avoided. Is it sharing of injection needles and surgical instruments to be avoided? Because of from infected person, if it has been shared, then definitely there are chances that it can have STDs. So this is about STDs. Okay, so I have prepared one more note of it. So in that one more note of it, what I am going to discuss is that as you can find, there are STIs and pathogen. What are these STIs? It is nothing but sexually transmitted infection, and which pathogen will cause it. Now this is helpful for your entrance exam. Okay, so first to syphilis. Syphilis is caused by a bacteria called as Treponema pallidum. Okay, Treponema pallidum causes syphilis. Gonorrhea, it is caused by one of the pathogen called as Neisseria gonorrhea. If it has been given in match the following and all, it will be very easy for you to understand. Gonorrhea, and its a species is also gonorrhea. Gonorrhea caused by Neisseria gonorrhea. AIDS, as you know, it is caused by a virus called as human immunodeficiency virus. Hepatitis B virus, HBV. Genital herpes simplex virus. Here I have given it as herpes, that must be herpes. Herpes simplex virus. Genital warts, human papilloma virus, chlamydiasis, chlamydia trachomatis, and trichomoniasis, trichomonas vaginalis. Okay, so these are the some of the diseases, some of the STDs or STI, and the pathogen which causes this disease. So all are very important in terms of entrance exam. Theory we don't have because it has not been given in the NCERT, so it has been not been asked till now. But if you are preparing for a NEET, then if you prepare for theory also, it will be better for you all. Okay, so this is very easy to understand, and use some tricks how to remember all this, and it will be very easy. Okay, next, at the last I have here one question related to STDs. All RTIs, RTI is what? Reproductive tract infections, are STDs, but all STDs are not RTIs. Okay, all RTIs are STDs, but all STDs are not RTIs. can you explain this sentence? Okay, I want the answer of this in the comment box. Please comment it, what does it mean with this sentence? Okay, already I said STDs are nothing but RTI, because while giving the other names, if you remember, here I have given it sexually transmitted diseases, reproductive tract infections, all those are same, but there is slight some difference among those. So please let me know what is that and what is the meaning of this sentence. Please search for that, search anywhere, wherever you want, just comment it in the comment box, so that I wanted to know either you are getting the answers or no. Okay, so this is about STDs, very important, very easy, and hope you like it. If you like it, please like the channel, don't forget. And in my next video I shall discuss about MTP, that is medical termination of pregnancy. So till then, stay tuned, stay safe, stay healthy.